the journey that we have done so far as MSP is concerned. So as sir has rightly pointed out that we are just taking the baby steps right now, small steps towards this journey. So just talking about the team, we all know that an ideal team should comprise about clinicians, microbiologists and pharmacologists. So we don't have a very structured team, but our HICC is very active in this, and we regularly have meetings of HICC where rigorous debate on AMR is taken up. So in that way, because in HICC team we have all these three sets of people, clinicians, microbiologists and pharmacologists. So in that way we are able to look towards this part of the MSP. And to begin with the journey, I would like to begin the diagnostic stewardship that we have been doing. So last year we were able to release the antibiotic policy of AIIMS Patna, and this has got the approval of MS sir and director sir, and it is available in all the wards and OPDs. So anybody can take help from this. Next, of course, it is as sir had aptly pointed out that right diagnosis at right time is very important. So we have been focusing on critical alerts and turnaround time for quite a significant period of time, and we have been able to do it quite significantly of late. Another thing that we have been doing is cascade reporting, where because when we look at the prescribers, then sometimes even the junior residents who are new to this, they also start prescribing the antibiotics, and they are not so much aware that which antibiotics should actually be given. So this is one example where we are reporting only those antibiotics which are the first line antibiotics, and we are restricting or not reporting those. You can see this is the actual report where we have lot of antibiotics which was sensitive, but we didn't report it as part of our cascade reporting. And again, a very important component is culture of cultures. We'll be hearing it time and around during this conference that people will talk about culture of cultures. So it is very important that all are aware that how to send the culture and when to send the samples. That is one very important aspect, and we have been conducting regular training and discussion on this with various ICU teams and ward teams. And during this discussion we have also come up with some discussion on antibiotic use also. So that has been a very good session for us. And what we have started right now is clinical follow-up of samples and reports. So our junior residents, they regularly visit the wards and ICUs whenever we see that we need extra information or we want to give extra information to the clinician regarding a patient or a report. And also entry of reports in WHO WHONET is being done. Recently we faced a problem because all the data of WHONET was being stored in a computer, and that computer crashed. So during that period we decided that why not upload this in Google Drive also, so that we can always retrieve these data from that part of the drive. So that was one thing that we have started doing it right now, and it is very helpful. I think others can also go about like this only. And another sort of innovation that we are trying to do is integrating the automation with the conventional methods. So this is something which actually will help in bringing down the cost to the patients also. So what happens ki normally when we are either doing it the conventional way or the automated way. So in that way sometimes the cost to the patient increases very much. We have devised a policy where we select which isolates have to go under automation for difficult IDs as well as MICs. So it is the policy of lab to decide this, and then we give the report as it is. And our pharmacology department also is very vigilant, and they have been doing the pharmacovigilance for quite long period of time, and I think in future days they will also take up TDR and PKPD kinetics also. So infection control stewardship is already going on for 3 or 4 years from our part, and what we are doing in order to control resistance and to control the MDROs, that we report these HAIs, whatever is occurring in the hospital real time, that whenever an HAI has occurred, we immediately release a report where the CAPA measures can also be taken, like the corrective action and preventive action strategies are also suggested in the reports, and these things are discussed with the proper authorities from or the in charges from the particular ward wherever this kind of reports are generated. So it is done real time. As soon as this is reported, our ICNs go and visit with this report and discuss the corrective action at that point of time only. Clinical stewardship also is being done. Mostly there is a way that we already normally talk on the telephone, and also WhatsApp groups have been created, where you can see one example is there that we discuss about the reports, how to do it, what not to do, what to do. And ID meets also have been done, although not very regular. We plan to make it more regular so that the benefit can be passed on to the patients also. Future goals, of course, what we are trying to do, we are trying to form antimicrobial order forms. Although the work has been almost complete, only the last part where we would like to discuss these antimicrobial order forms with our clinical colleagues also, and then we will be able to release this. Advantage of these antimicrobial forms are that they will be a very short sort of a form, where we will give the sensitivity pattern of various isolates, so that it will be available in the form of cards to the clinicians, and they can very easily go through, because books are something which are difficult to go through, but cards, a single page card will be much easier for anybody to go through and find the relevant sensitivity pattern. And what we are trying again is to start the MSP rounds involving the clinicians, the pharmacologists and microbiologists, so if an integrated round can be done. So this is what is our aim, and a short play also has been based on this theme only. So journey of AIIMS Patna as far as MSP is concerned has just started, and we have a very long way to go, but definitely we will achieve success if we continue in this path. So thank you all for this.